it's been a bit of a devastation really to think all this work, all this time, just overnight it's gone just for the sake of a virus that I caught. As far back as I can remember, I always said I wanted to be a nurse when I was younger. I really enjoyed talking to patients and teaching the public. You know, nursing, even if you don't want it to, it does kind of end up taking over your life. You know, you kind of end up sleeping and breathing nursing. It is horrible to kind of look back over this career and see that that's gone. But unfortunately for some people like me, we've been left with long COVID. It is horrific, it is life-changing. My name is Nichola Baker. I live with my husband and my daughter, who is 7. We've got a pet dog called Max, who's a cockapoo. I've been nursing since about 2008 was the year I qualified. The first time I caught COVID, whenever I sort of got up off the sofa to go like make a cup of tea or something, my heart rate was jumping up to like 180, 190, and I'd be breathless just walking a few steps. My body was aching. I ended up with like hormonal issues. Got diagnosed with endometrial hyperplasia, so I was bleeding a lot. I had like tendonitis in my feet, so I couldn't really walk very well because my feet were just painful. The brain fog and confusion were ridiculous. And I was getting pressure to come back to work because obviously other people were off with COVID and we were still in the thick of it. A few weeks later I asked could I be referred to occupational health. It was quite difficult managing work and their expectations and my limitations with the health situation I was finding myself in. But then unfortunately the June I caught COVID again. I was off work for about a year after that point. So I went from taking 2 tablets to 15 tablets and 2 liquids. Now fortunately it's mainly these ones. Yeah, this allows me to not have to stay in bed all day. It is almost seen as if it is some kind of moral failing that I haven't got better. It's like a personal attack on my character that I've developed this condition when, you know, it's just a roll of the dice.
One of the biggest barriers to people returning to work or getting the reasonable adjustments they needed would be attitudinal. And we see that so much in nursing, and we're hearing it more and more with long COVID, that actually members are going to work or they're having a call from their manager and they are not believed, and there'll be phrases like, "but you look fine." And it's so damaging. There's a chance of a relapse to more severe symptoms if you overdo things. So I'd be looking to managers to really frame a collaborative discussion and be as creative as possible when thinking about that phased return will work.
So fortunately having the RCN on my side really helped. My rep was really good and he stood up for me and my rights. Having their knowledge and their experience again with other people with COVID, it was really helpful and they really sort of fought my corner.
Whether it is an ill health retirement query or you're just at that crossroads and you're not sure what's next, best thing to do is get in touch with us. In my role at the RCN, I run a peer-to-peer network for members with disabilities, and when COVID hit, we set up a Facebook group quite early in the pandemic, and it wasn't long before more and more members were joining with long COVID. So at the moment, that group has over 300 members.
Because it was very lonely at first, that kind of, is it just me? Like, am I just overreacting? But then you go on this forum and there's like hundreds of other nurses that are like, I can't work. It's nice that we're all there together and we can support each other. I did a return to work and started going into the office 1 day a week and tried to build that up. So they made some sort of allowances, but I felt like the whole time I was under extra scrutiny. I don't know what's going to happen, really. Fortunately, I was successful in applying for PIP, so I have some money coming in.
There's such a lot here for employers to look at. Are your managers well-resourced and supported to make decisions that will help them to help employees? And can you afford to lose these staff with these skills and experience? So often there's a knee-jerk reaction to get rid of someone because it's challenging to keep them in the role. But I don't understand why we're still seeing this at a time when we're so short-staffed and we're lacking those skills and experience mix.
it will be at the NHS's detriment to lose this level of skills and experience. We should have a bit of empathy for people in this situation. It could happen to you, it could happen to any of us, just one infection away.